Hola, everybody. It is May the 31st, last day of May, 2017, and this is my 2-month post-op update. Yesterday, I went in for my 2-month post-op, even though, it's a little like a day early. And I weighed in at 220 pounds, which is like a 2-pound loss from last week of my 7th week update. That is a total pound loss from my surgery date of April 5th. It's a total pound loss of, let me think, my surgery date was weight was 245, and I weighed in at 220 yesterday, so that is a 25-pound loss. Plus included the excluding the 8 pounds I lost on a pre-op diet in March. So we're looking at 33.5 pounds total since I started the whole 2-week pre-op diet until today. That's pretty good. Can't complain. Won't complain. They were a little concerned with my blood work. It looks like my WBCs are low. I had the lab work done a few weeks after I had my surgery, so I'm quite sure the blood count was low. The WBC was low because of the surgery. I'm hoping that that's what the issue is. Because in March, when I took the labs to have the surgery, my blood work, my WBC count was normal. And now, when I took it a month ago, it wasn't. I'm quite sure it is now. And then they were concerned about the tube. I guess there's a tube after you swallow, because I did a swallow test yesterday with them. After you swallow, there's like a little tube before it goes into your stomach. That tube was real narrow, they're saying, because she was concerned why I wasn't getting 60. I'm talking weird because I got these white strips on my teeth. So it's there, you know. I'm talking funny. But anyway, she's concerned, the PA was concerned why I'm not able to get 60 ounces of water in. My thing is you want me to try to eat as much protein as I can. Can't drink within 30 minutes, an hour after you eat. Can't get 60 grams of protein in at once, so I'm grazing. Yeah, to add up the protein, and then I got to get 60 ounces of water. I'm doing the best I can. There's sometimes I don't feel like drinking any water. I was a little frustrated yesterday. I was going to do an update yesterday. I'm still a little frustrated, but I was extremely frustrated yesterday, and I just wasn't going to send the video through. So yesterday I made it a point to drink more water, and that started at 5 o'clock after I got out of my frustration mode. So I managed to get 40 ounces of water in yesterday. It wasn't so bad. That's the most water I've been able to drink in a single day in the 2 months since I've had the surgery. So that's an improvement, because she was talking about EGD next, and they're going to have to probably fix the narrow of the tube because it's so narrow. I'm not doing any of that. I can swallow just fine. I can get foods down with no problem. And we're not going to fix any of that. I'm going to continue on doing what I'm doing. As long if there's no signs of an obstruction or anything like that, I'm just going to have to make sure I get my water in. So today's a new day, and I am going to try to knock out 20 ounces of water within the next 2 hours, so I could get 60 ounces in. I want to see if I can do it. I'm sure I can, because from 5 o'clock to maybe 11 o'clock last night, I managed to get 40 ounces in. Well, maybe about 30. Yeah, probably about 30 ounces or so. I'm not too sure, but I'm going to do my best, the best that I can today to get in 60 ounces of water. But other than that, I'm good. I'm, 220 pounds, 20 pounds away from hitting that 199, or 21 pounds away from hitting the 199. So I'm hoping that by the time my birthday rolls around in July, I'll be, out of the twos, or coming out of the twos, coming close to the coming out of the twos. All right, well, I'm about to make my errands. Got to run around, but I give much thanks to everybody who's listening to me and my vlog. I, y'all are like an inspiration to me when I go through the YouTube videos. New Nisi, girl, yeah, you keep me going. Um, VSG Pretty, you also keep me going. I don't know. I appreciate everybody. I appreciate this journey that maybe I should have taken 10 years ago, but oh well. I'm on it now. But other than that, it's the VSG. The stomach is very fickle. One day I can eat all day. I can eat all day. Just, and then it alarms me sometimes when I can eat as much as I can in one day, and then the next day I'm lucky to get 30 grams of protein in, or I won't even get past maybe 300 calories. Like, next day, I just can't eat at all. So it's very fickle. Other than that, everybody, you have a wonderful, wonderful week. This weekend, my son graduates high school, so that's part of the errands I got to run around and do now. Get his gift and uh, and just get everything together. But other than that, have a wonderful weekend. Ciao.